Hello everyone, this is mainly for the parents and it's the nurse from Hiyos practice, and I just wanted to inform you little information regarding baby vaccination at 8 weeks. So the first thing you have to make sure as a parent is that your child has had a little check, 6 to 8 week check with the doctors, just to make sure that the child is fine. So and before also you come to the surgery, make sure the child is feeling well and is not spiking up temperature that is more than 37.5. So if you have your child having high temperature, or you're uncertain about your child, just call the surgery and you'll speak to the nurse and you should be able to tell you what to do. Another thing is, before you come to the surgery, make sure you have your red book so that you can exchange the records of the immunization details with the nurse. So when you come to the surgery again, the nurse is going to give your child 3 injections, and the injections are here. This is called meningitis B, and it's also called Bexero. And the second injection is Immunisations hexa, and this has got 6 immunizations, 6 viruses in one. And this is also called Rotarix. It's usually a drop that will be given through the mouth. And if I'll just tell you a little information about these vaccinations so that you understand. Let me start with the Rotarix. Rotarix is usually given 2 vaccinations when your child is when the child is 8 weeks and when the child is 12 weeks, and it should not be given when the child is over 24 weeks. So that is very, very important. So when your child is over 24 weeks, they will miss the Rotarix. So make sure that the child has got is below 23 weeks and has gotten the 2 Rotarix doses. So Immunisations hexa is also very, very important. This one has got 6 viruses into one, and it's all written here in the. I can show you through here what is all written. It's got diphtheria, tetanus, pertussis, that's a whooping cough, polio, Haemophilus influenza type B, and it's also got hepatitis B. So this vaccination is going to be given 8 weeks old, 12 weeks old, and 16 weeks old. And it's one of the most important vaccines that we give to the child now. I'm going to demonstrate on how parents are they're gonna hold their child when we are going to vaccinate them. Okay, so here we go. So this is a little doll. So make sure the parent holds the child, support his hand with your, like that, like you're breastfeeding. Like actually, when a mom is breastfeeding her child, that's the most comfortable position for the child. And then with this hand, that's fine. And then with this hand, you're gonna support the thigh of the baby, because we're gonna have the lateral side of the thighs. That's where we're gonna put the injections. So when the child is like that, it's comfortable and it's warm, and the baby will not cry because it's next to the mom or the dad. So we go and inject around there. That is where we inject the baby. Okay? So the baby will cry. Do not freak out. That is just very, very normal for the child to cry. And we'll put a small plaster for the baby. And most of the parents freak out, but the most important thing is just to stay calm with your baby and just make sure the baby is comfortable. So after that, with this kind of injection, the meningitis B, it usually gives the baby high fever. And when the babies are small, we prevent any high fever to happen to the child, because it can have a very bad side effect. So when you go home, make sure immediately you give the child paracetamol, 2.5 mils immediately. Then after 4 to 6 hours, you repeat the dose, 2.5 mils. Then again, after 4 to 6 hours, you repeat 2.5 mils. And in between, just keep monitoring the baby's temperature all the time. If at night the baby spikes temperature, please make sure the child goes to the hospital if the paracetamol is not working.